Hello everyone. Hope all of you are doing well and safe. I am Mamta Carroll, Vice President, Regional Director for Asia of Smiletrain. Smiletrain is an international NGO that supports free cleft treatment for children globally. Our sustainable model empowers local medical professionals to provide cleft care in their own communities. Globally, we have supported more than 1.5 million cleft surgeries in about 90 countries. Today, I'm very pleased and honored to welcome Dr. Krishnamurthy Bonanthaya, our maxillofacial surgeons from Bangalore. Dr. Krishnamurthy is a Smiletrain partner since the last 20 years and heads the cleft program at Bhagwan Mahavir Jain Hospital in Bangalore. He is also a member of the Smiletrain Medical Advisory Council in India. So, Dr. Krishnamurthy, a very warm welcome to you.
Thank you.
So, Dr. Krishnamurthy, today we are here to talk about a birth difference, which is fairly common, but people don't know about this. People really don't know what happens really when a child is born with a cleft. So, from a medical perspective, please could you tell the audience about what exactly is this birth difference?
Mamta, thank you very much for having me here, and thanks a lot to BabyChakra for inviting us here. Cleft of the lip or palate is, as you mentioned, a birth difference. When the baby is born, a part of the upper lip or the inside of the mouth has not formed completely, and it exhibits a gap between the two areas. So this is something that happens as a result of certain missed signals at the time of the development of the baby within the mother's womb. And it happens in most countries around the world in about 1 in every 700 live births. Yeah.
Oh, okay. So, it's like 1 in 700 would really mean about 35,000
Yeah,
children in our country.
that's
Is that
right.
true?
That's right.
Oh
So
my
it
goodness.
translates to about 35,000 new cases of babies being born with cleft of the lip or the palate in this country. And there are certain issues that crop up in these children when they are born. And the most important one right in the beginning is probably difficulty in feeding the baby. So we all know that the first interaction with the mother and the child is usually in the form of breastfeeding, and this is something which is a natural process. This is something which may be very difficult in a baby that is born with a cleft of the lip, particularly a cleft of the palate. So this is where things happen differently, and the parents need to be aware of what to do in this kind of a scenario. Yeah.
Okay. So yeah, as we know that many people may not be aware that the cleft or the cleft of the lip or the palate is completely treatable. What is the medical treatment for a child with this condition so that they can lead like a normal productive life as other children?
Yeah, this is something that the awareness of this is quite lacking in various regions around the world, including many parts of India.
Mm-hmm.
That this is a difference in a baby when she is born, which is very easily and eminently correctable. And with the kind of protocols that we have today in place to treat these children, it's almost guaranteed that they can lead a completely normal life. What we need to do, however, is different interventions at different points of time in the life of the child, and this parts of this treatment might extend from the time the baby is born till she grows up to be an adult. The primary intervention or primary modality of treatment for the cleft of the lip and palate is surgery. So what surgery does is it restores what was not normal, what was not functioning properly. So that is the aim of surgery. But surgery is not the only thing that is required. There are other interventions that are needed. So medically managing children with cleft lip and palate is usually a part of a well-knit team. It's what we call an interdisciplinary team of medical specialists who work in tandem, in consultation with each other as the baby is born till she grows up. So in addition to doing these surgeries to restore normalcy in the lip or the palate, we also have to resort to help from a specialty called orthodontia or orthodontists. These are people who on a day-to-day basis cause movement of teeth and jaw bones to different places. So even before we do a surgery, the orthodontists oftentimes carry out a procedure. This is within days after the baby is born, a procedure called as nasoalveolar molding. Basically, this is an intervention which is done to alter the shape of the gums as well as the nose, so that by the time we are ready to do the surgery, the deformity is corrected to a great extent. So oftentimes, once the mother learns how to feed the baby, this is the treatment that is carried out, the nasoalveolar molding, and around between 3 to 6 months of age, we would carry out the first surgery, which is the lip surgery. And the cleft palate surgery is done at around 9 months of age, 9 to 12 months of age. And here is a very important thing that we need to remember, that one of the problems that could occur in a child with a cleft palate is difficulty in speaking. So it is critical that this cleft palate is repaired surgically before the child is a year of age, generally. The reason being that we want the apparatus ready when the baby starts to speak. Otherwise, it's because of this not normally functioning palate, you could end up baby having difficulty speaking, and then the consequence of this would be that people might find it difficult to understand what the baby is saying to us. So getting normalcy of speech is an extremely important component of managing these cleft deformities. And the first step, obviously, is to get the cleft palate into its right place and orientation by doing surgery. But another very important cog in the wheel or part member of our team is the speech and language pathologist, often called the speech therapist. Now, these are people who will assess the language development skills of the child. And after the cleft palate is repaired, they work with the parents over the few years as the baby learns to speak. Remember, even in a completely normal baby, you don't start speaking everything in one day. This is a process of development. But it is natural. It usually does not require anybody to help the baby with. But here, as the child starts to speak, the speech and language pathologist works with the parents to encourage the child to come out with normal speech. And sometimes it's possible that even after a cleft palate is repaired, the child might have difficulty pronouncing certain words, certain syllables, and then the SLP or the speech therapist would then guide the child and the parents to correct these things, so that by the time the child's ready to go to a proper school, she's speaking normally. So these are the important components of medical management.
Sure. Yeah. So if we were to just look at the numbers, as we discussed earlier, that 35,000 children are born in our country with this birth difference every year. How, as a cleft surgeon, how do you identify these children? Do you see them walking into your OPD and availing this treatment? How do you work with other teams?
Okay, so there are various points or various points of contact where we come in contact with these patients. Today, what tends to happen is during pregnancy, there is a test that is done, an investigation that is commonly done, what is called as the ultrasonography. It's ultrasound. So when the ultrasonologist is doing the ultrasound with the mother's uterus, she finds how the baby is developing within the womb or the uterus. And this anomaly or difference can be picked up by the ultrasonologist even while the mother is pregnant. So after about 16 or 18 weeks of pregnancy, which we call the second trimester, when they do this scan, they do the scan for various other purposes, generally looking after the well-being of the fetus. They can find out that this has occurred. And then in that situation, oftentimes, we then counsel the parents even before the baby is born, telling them, see, look here, this is going to happen. This is not the end of the world, that there is a proper mechanism in place to help you out. And also at the time of birth, whether it is the obstetrician or the pediatrician who is always present at a delivery, will look for any of these birth differences. A checkup is done by the pediatrician at the time the baby is born, and many a times the pediatricians pick this up. Sometimes when the difference or defect is not very obvious, it may be missed for a while, and then the child develops a problem, like for example, she's grown up a little bit and is not speaking well, and that's when it comes to our attention. Right. This is for people who get regular health care. We also have a large section of our society that is not so well endowed. They don't get to reach the healthcare facilities. In these situations, we also work with social workers in our teams that are trained to go and identify them in the community. We work with the various governmental organizations, other NGOs in rural and semi-urban areas, and then spread awareness that the defect like this could be very easily treated, and where it could be treated, and so on. So social workers are also forming a big segment of our work, where they identify these patients and then get them to where they can be treated.
Yeah. Right. So, Dr. Krishnamurthy, given your experience in working in this space for over 20 years, what do you think, in your opinion, are the major challenges in the society due to which parents are reluctant to get the treatment done for their children? Remember, it's in your face, so everybody can see it. But there are certain things or certain myths or certain things that happen within the families, which is really kind of stopping them from approaching the right kind of medical treatment. So, what, in your opinion, do you think they are?
So there are three big impediments as we see it. One is the lack of awareness, which means oftentimes the parents or the family are not aware that this can be treated easily. There are instances where they believe that this is God-given and they have to live with it. So at the very basic level, there may be a lack of awareness that we could do something about it. This is something which we see quite often. And the second one, which is very common problem in a country like ours, is affordability. Basically, in the kind of healthcare system that we have, affording the cost of this treatment has been a huge impediment, particularly in the years gone by, where more than 3/4 of patients that were born in our country did not receive any treatment. And the third one is accessibility. Basically, these kind of cleft surgeons or cleft teams are not found everywhere. This is a highly specialized or a niche area of healthcare, and therefore awareness as to where to obtain this care also could be a problem. Many times we have parents who come in and say, "Oh, we did not know that you do this treatment here," and that is the other problem. Yeah.
Right. And I'm sure in your experience, you also must have come across certain myths which is associated with this anomaly. Yeah. So would you like to talk about those? What are those?
Yeah. We are good storytellers, in this country. And sometimes it's the storytelling can have a detrimental effect. So one of the most common myths associated with cleft lip is that if a pregnant mother goes out and sees the moon or the sun during an eclipse, that you'll get cleft lip. In fact, in some of the Indian vernaculars, the definition of a cleft lip is related to an eclipse, Okay. So, or various other kinds of things like you see a knife, or you use a knife, or and then it doesn't grow. And many times these kind of things also ends up in a blame game, unfortunately. And oftentimes it's the mother of the baby that is at the receiving end, because it's very easy to blame, in a misogynistic society like ours. It's very easy to blame the mother and say, oh, you've given birth to this child like this. And oftentimes there are tragic tales of the family refusing to take care of the child, or the father leaving the wife and the child. And these are peculiar circumstances which makes it more poignant, which makes it more difficult for the family to handle this.
Yeah, and from a child's perspective, because I'm sure sometimes the surgery is not done at the right age or the ideal age, and then the children grow with this, live with this and birth difference for several years before they are helped, or they contact you and you give them the treatment. So from a child's perspective, what are the problems usually faced by them?
Yeah. So we discussed about the medical issues like inability to feed, inability to speak well, sometimes swallowing and breathing issues. But more importantly, as the child grows up, it's the psychological trauma, the psychological impact that could well be an issue. Children, can be cruel sometimes, and then peers fun of them, being bullied at school or at play areas, is something that is very commonly observed with these children. And if we do not teach them the mechanisms how to cope with this psychological pressures, it can be something that causes significant damage to the psyche of the child. Yeah, so that's also an important issue that we need to bear in mind. Show how, or teach the child how to cope with it.
Yeah. So would you like to share any of the stories of such children who've come to you and you've treated them?
Yeah, I can relate a couple of them. One of the issues, like I mentioned earlier, is difficulty in feeding. So I very vividly remember this child that came with her parents a few years ago, and 2 or 3 months after the baby was born, the baby had failed to thrive. Instead of doubling the weight from 2.5 to 5 kgs, this child had reduced the weight from 2.5 to 1.5 and was just skin and bones. Now, the reason why this happened was because the mother was not educated or trained how to feed the baby. There was no issues of not being able to afford food. Remember, all you need to give these children is milk, and people can afford that. But it was complete lack of knowledge as to how to feed the child had made this child become severely malnourished. All we did with this child was to admit him and then show the mother how to feed the child, and voila, he started increasing weight 20 grams a day, and then in a week he was gone. And from a skinny, bony 2.5 kgs in the month of September, he was a chubby 7 kg old in February. And it's a life transforming thing, because what we need to remember is that most of the development of our brain, which happens after the baby is born, about 90% of it takes place in the first year of life. And at that point of time, if you're deprived of healthy nutrition, the kind of damage that it might do to the rest of the life of the child it's difficult to assess. And therefore, this is something which we keep emphasizing on, because there is a little difficulty in feeding. Don't give up. There are methods of doing it. And this one instance is very vivid in my mind, because you dramatically change the life. All you did was told the mother how to feed your child. The other instance now I mentioned to you about prenatal diagnosis. That is, ultrasound has been done, and then ultrasoundologists today send these parents to us when it's a very devastating thing to happen. You are expecting a baby to be born, and here they say your baby will be born, but with some differences, defects, whatever you call them. And that's not something parents are happy with. Arrival of a child is such a joyous event, and they are in shock. And one of the things that tends to happen with this is the parents at this point of time are wondering whether to continue with this pregnancy. This is a problem that is there around the world. And many a times when these parents come in immediately after the diagnosis, being referred by the ultrasonologist to the treating team, this is the question that they ask. Should we terminate this pregnancy? And we are not judgmental at any point of time, but we do explain to them the mechanics of what will happen and how eventually, in a matter of a few years, your child will be as normal as anybody else. And I do remember coming out of the OR one day, and this grandmother was standing outside. I was doing the second surgery, and then this was a grandmother who was not very happy. She's the one who had wanted them to abort. Okay. And then I asked her, do you think you did the right decision deciding not to abort? And after a little thinking, she said, "Doctor, I never wanted to do it," she said. So she had forgotten it, that she even wanted to get rid of that fetus. So these are transforming moments, and this is what we work for.
Yeah, amazing. How touching. And I can imagine that every day, in addition to, the work that you're doing, you come across these instances which are, you make you relate to them, not as a doctor, but as a human to human, just as another human being, right?
Absolutely.
Yeah. So getting into the details, how much does a cleft surgery or a cleft treatment cost? And what has been your journey with Smiletrain? You were a long-standing partner, and how would you, tell our viewers about your experience with us?
Right. The story of clefts in India will not be complete without the story of the Smiletrain. They're quite closely entwined. I'll tell you why. So Smiletrain came into this country in the year 2000, right? And at that time, they carried out a survey with the help of Tata Institute of Social Services to look at what was the current magnitude of the problem in this country. And the numbers and the details they found were quite overwhelming. I mentioned this number earlier, 75% of the children born, which means more than 25,000 or 30,000 every year, were not receiving any treatment till that point of time. And by then we had backlogs of hundreds of thousands of patients who were not treated at all in this country. And Smiletrain came with this model of empowering local teams. Funding, remember, affordability was an issue. So Smiletrain said to all these hospitals that they identified as they expanded, they said, you go ahead and do all the treatment that you want. We will take care of the resources, the financial resources. So when we started off, we used to do surgeries free of cost. And then we started doing speech therapy. We started doing the orthodontic treatment. And then Smiletrain turned around and said, we know there is a problem for patients to come from far off. You might do the treatment free of cost, but they may not even be able to afford the bus fares. And they said, okay, we will pay you money to provide for transport of, and sometimes help children with medicines or their education. So it became an all-encompassing model of treatment. And this has grown leaps and bounds. Today, we have like 170 odd partner hospitals in this country doing more than 40,000 surgeries. We have crossed 600,000 surgeries in the last 20 years. And in terms of cost, all it costs for this organization to carry out these surgeries is about 25,000 rupees. However, if you were to walk into a private corporate hospital and get it done, it would be a few lakh rupees for each surgical procedure. Yeah.
Yeah, and what about your the safety and quality, the patient safety at Smiletrain centers, and what has been your kind of journey as far as safety and quality is concerned?
This is something, again, extremely important. I will tell you from experience that even when we offered all these things free of cost, particularly people from rural areas, I work at Bangalore and I treat patients born with cleft lip and palate at around 200-kilometer radius around this city. And particularly for rural people, when we found them, when we approached them, and when a social worker said, come over, we'll do everything, they did not believe us. There's always this cynicism. Why would they do it for me? And there's also horror stories of going to a hospital and missing your kidney later on, and so on. These kind of things have happened in our setups. And therefore it is important for us to educate the patients that, look here, we are not just doing this as a charity, as free of cost, but we have the best of the systems in place, including the safety. So Smiletrain always emphasized time and again. Now I work in the medical advisory board and I know how it works. Time and again, they look at the outcomes, they look at the practices being carried out in the hospitals. And whenever there is something that is amiss, whenever there is something that doesn't go very well, they look at it and recalibrate and advise the doctors what to change. So basically, safety has been an extremely important item, top of the list for Smiletrain. And therefore, I would say that all parents who bring their children for a treatment to any Smiletrain center can safely walk in, believing that that the safety of their child will be the utmost concern for the treating team. Yeah.
Oh, that's fantastic. And as a doctor, what would you say to a cleft patient and the cleft patient's family? What is your take-home message to them?
Right. Take-home message is simple. Life throws adversities at us. We don't know when it comes. Right. It might come when the baby is born. It might come when your child is 5 years old. And it happens to everybody in one form or the other. In your case, it has happened at this point of time. But fortunately, today, we have medical science that is advanced to this degree, financial resources that are available, people who are kind enough to set up these systems. So what I would like to tell, or what I normally tell the parents, is that leave the worry to us. We'll make sure that your child will lead a normal life.
Yeah, absolutely. And what about to lay people, to people who are watching, or people who have fortunately not had a brush with this anomaly, but either want to know more about it or generally want to join the cause in terms of spreading awareness? What would you say to just the general public, just lay people around?
Yeah. What I would say is that the kind of healthcare models that we have in our country, where the public health system struggles to cope and where private care is expensive, it is extremely important that if you're fortunate, not only spread awareness about it, but also try and contribute to this cause. A lot of the money that is required for the management of these children comes from all over the world. But today, I think in this country, we have millions of fortunate individuals, right, who can help us deliver this model in a normal way by just contributing their might. They can also, when they identify a case, they could help these parents or children get to the right hospital, etc. And Smiletrain actually in this country has an helpline number. I would read that out. It's 1-800-103-8301. So anybody can just call this number, 1-800-103-8301, and that's our helpline, and we would take it from there. And if you want to know more about how these things are done, you can also go to our website, which is smiletrainindia.org. And I think nation building occurs in different ways. And if you have something to spare, I think you should. This is one cause to which you could contribute.
Oh, that's wonderful. Thank you so much, Dr. Krishnamurthy, for the fantastic, insightful session. There's so many things that we learned from you today. And the only thing that I would urge you viewers to do is come forward to support the cause and help your child lead a completely normal life through the surgery. If you have somebody known who has this anomaly, remember it's totally, completely treatable. We have 150 centers in India and more than 1,100 centers worldwide in 90 countries, where world-class cleft treatment is available totally free. There's nothing which is charged. In addition to cleft surgery, we also sponsor speech therapy and orthodontics and psychosocial support and nutrition. And through all our partner hospitals, we at Smiletrain have supported more than 6 lakh surgeries since the time we started in India 20 years ago. And I would like to repeat that we are just a call away. We are at 1-800-103-8301 for help, for a complete help and complete information on cleft and its related treatments. Thank you so much for watching. I'm going to take some questions, Dr. Krishnamurthy,
Yeah,
that
sure.
people have given us.
Sure.
And those are Ma'am Sonam Patel is asking whether the baby will have any developmental disabilities.
Right. So generally, cleft of the lip and palate is not linked to developmental disabilities as such. So if, in other words, if a child has a cleft of the lip and palate, there is no reason why that child cannot completely grow normally and perform all kinds of functions. However, there are a small subset of these cases, what we call as syndromic cases, where in addition to the cleft lip and palate, other anomalies might be there, which might include the nervous system, the brain, etc. When it happens, then there could be issues. But in general, there is no what we call as a non-syndromic clefts. There is absolutely no association with any developmental problems. Yeah.
Then I have another question from Kavita Sahani, and she's asking that will our baby have trouble learning to talk?
Right. I think we touched upon this a little bit in the beginning, but let me explain this in a little more detail now that this particular issue has been raised. It is possible that a child with a cleft of the palate, even after it has been repaired, might find it difficult to speak normally. There are issues with pronouncing certain syllables. Oftentimes, it's those which require us to build up pressure in our mouth. For example, saying something like a p, like a sh, and a s. Right. So what happens is these words may come out differently, and then it may be difficult for the listener to understand what the child is saying. And many a times the parents themselves get used to this and they think the speech is normal, So therefore, it is very important that even after repairing a cleft palate, a speech and language pathologist or a speech therapist, they are one and the same, assesses these children from time to time, picks up these developing problems, and if it is done quickly, it is easy to reverse it. Longer a child continues to speak in a particular fashion, which is not normal, it's more difficult for us to reverse the process because this is a learned habit. Yes, speech is something which we should keep in mind. But this is not applicable for children who are born with the cleft of the lip alone. Okay. If it is just cleft of the lip alone, it never causes any issues with speech. It's completely developing normally as would be in other individuals. But when there is a cleft of the palate, yes, this is something which we have to watch out.
Taken care of. What about feeding? So I have a question from Durga Salvi who says, can our baby be fed properly? So I guess, yes. I think she's talking about either the lip or the palate. I'm not
yes.
Sure.
So this is, again, could be a challenge sometimes, as I've mentioned a couple of times earlier in our conversation. If a child has cleft of the lip, once again, normal breastfeeding is possible and it's not a major issue. Mm-hmm. When there is a cleft of the palate, the problem is the baby can't suckle the breast effectively. In other words,
pressure to
so the child will try to suck the breast, but the milk will not flow in because the negative pressure does not develop. And in this instance, if it is not realized, what will happen is the baby will be spending more energy trying to suck the milk rather than getting anything out of it. And then these are cases where they fail to thrive. So in a case of a cleft palate, very rarely you are able to do breastfeeding. We'll have to resort to alternative methods. They are very simple and straightforward. One of the things that we constantly ask our parents to do is to express the breast milk. Remember, breast milk is not only, breastfeeding is not only good for the bonding to develop between the mother and the child, but it also has the ingredients in the perfect fashion. So when breastfeeding is not possible, we then go to the next alternative where we ask them to express the breast milk and then feed. So how it is fed? It's fed either with a spoon or with an instrument called a palada. There are bottles that are available which help a child to feed, but not the regular bottles that you use, because these regular bottles requires the same sucking or negative pressure effect. So there are various instrumentation that is available, or armamentarium that's available, and when you feed, the position of the child also has to be slightly different. It has to be at an angle of 45 degrees rather than the child lying supine. So these are a few things that has to be altered, but they can be fed normally. Just today I operated a cleft palate child, 10-month-old. He's 10 kgs. He's chubby and he's very, very healthy. It's not a problem at all. Not a problem.
Yeah, and I think in Smiletrain we also have various resources. So we have a feeding video. You know, as partners, we have partners give leaflets or booklets get made specifically on feeding. A lot of resources are available online. As far as feeding is concerned. So you want to specifically get into how to do it and what are the positions to have the baby when you feed the cleft child. All of that is available.
Right.
We can help you with that.
Yeah.
I have another question. I guess it's from Madhavi Kolera, and she's asking, how do we fix a cleft palate?
Right. So magicians, right. So it's a delicate surgery. It takes about 45 minutes to an hour. The most important component there is to get your muscles together. So the palate actually has got two parts, what is called the hard part and the soft part. The hard part is in the front, the soft part is in the back. The soft part is where the muscles are, and these muscles are not joined together. So all of you who might do workouts and go to the gym or run will know that how important muscles are for activity. So what we basically do is get the muscles back into their place so that the soft palate can function normally. So it's a surgery, takes about 45 minutes to an hour. It's a very safe surgery, very predictable surgery. Yeah.
Thank you. I have another question from Rebecca Prakash, and she's asking, what really causes a cleft palate, and can it be corrected before birth?
Right. That's a very interesting question. I'll take the second part first. Can it be corrected before birth? Because we've already mentioned that today with the technology of ultrasonology, we are able to diagnose or find out that the child has a cleft of the lip or palate at 16 or 18 weeks. And we still have about 25 weeks of the pregnancy left. So there is a developing science in medicine known as fetal surgery, where different anomalies are corrected even before the child is born. But it is not as simple as we think. You will have to do like a C-section, get the child outside with umbilical cord still attached, do the surgery and put the child back. Okay, so this kind of a fetal surgery is developing some traction where these are life-threatening conditions. Imagine a situation, there are conditions like tracheoesophageal fistula, etc., where the child may not survive or may die very soon after birth before you can treat them. In these kind of situations, it is worth trying these fetal surgeries. But in straightforward conditions like cleft lip and palate, it's too much of a risk, because there is a risk on both the fetus and the mother if you're going to do this kind of a surgery. And it is not, all these are in the experimental levels, and it's not going to take off in a big way, because we still don't know whether we should take the risk of doing this. Now, why cleft lip and palate occur? Once again, this is $1 million question. We are answering it in a few dollars at a time. But basically, there are two buckets into which the causes fall. One is called the genetic bucket. The other one is called the environmental bucket. We know today that environmental pollution is a cause for various problems, including respiratory ailments, breathing difficulties, etc., etc. There's also a lot of these environmental factors that might cause cleft of the lip and palate. Environmental factors may be some certain drugs that the mother has been taking. Classic example is a drug called phenytoin sodium. This is a drug that a person who has epilepsy or fits or seizures is prescribed. And if the mother has to continue to take these tablets for that disease during the pregnancy, this kind of a drug could influence normal development of the child. So there are various other drugs which are postulated. We don't have enough evidence, but they do cause anomalies. And then also diseases or infection that a mother could suffer in the first trimester of pregnancy. That's also an insult from the environment, which could cause problems. Some of the classic infections that do have a role in causing these defects include rubella. You know, all of us get a vaccination when we are about 12 to 15 months old, and this vaccination is called the MMR vaccine. MMR protects us against mumps, measles, and rubella. So if you've had, as a child, if you've had this MMR vaccine, you are immune to rubella. In other words, when you're pregnant, you're unlikely to get it. But in a girl child who has not undergone this immunization, she gets a rubella. It's a very mild illness, doesn't cause a problem like some of the other viruses that we see around today. But this rubella infection at the time of pregnancy can cause a clefting of the lip or palate, or it can cause a difference in the development of the heart, for example. So that's another environmental influence. The other common cause, which has been implicated from an environmental point of view, is nutritional deficiencies. This is something which we can easily understand. We have a third to half of our population that are nutritionally not well served, and something like a folic acid, which is a type of vitamin, it has been said to cause the deficiency of the folic acid in the mother's diet during pregnancy, said to cause these clefts of the lip and palate. There is very straightforward linkage between another anomaly known as the neural tube defect, which is caused due to folic acid deficiency. So the deficiencies in your diet, infections during pregnancy, drugs that you may be taking, all of these are environmental factors.
Okay. So there's another related question from Revati, and she's asking, is it a hereditary disease?
Yes. So we were talking about the genetic bucket. So what happens? The beautiful process of a single cell egg becoming an embryo and a fetus and developing into a human being is controlled very, very complexly. So at every stage of this development, from a single cell to a complex organism, there are a lot of signals that come out, and these signals make sure that it is happening in an orderly fashion. If some of these signals don't arrive, or a wrong signal comes in at that time, then a misstep could occur. And these wrong signals are conveyed by what we call the genes. Right? So genes are the ones, when they have altered, when they have abnormal patterns, can give rise to these cleft lip and palate. And these genes can definitely be inherited, which means the genes is being passed on from father to son to daughter to and so on. And it's always a possibility that the cleft lip and palate can be inherited, but it is not always the case. The genetic changes that cause a cleft lip and palate may not be present in the previous generation. It might have occurred at the current generation, and therefore it may not be inherited at that point of time. I hope I'm making this clear.
Yeah, you are. So another question is that I think she's wanting to know, this is Bhavna, how many surgeries are there for cleft lip and palate? I think her question is that if a child has a lip and a palate, how many surgeries are really required for him or her to get like a completely normal, like you and I?
Right. So two primary surgeries, which we already mentioned, correcting the defect in the lip and the palate. So that's two. And then in addition to that, the child will require what is called as a bone grafting surgery when she's about 9 to 10 years of age. Now, this is a procedure that is done on the gums so that your teeth can come into the right place. These are the three essential surgeries that are required for everybody who has a cleft lip and palate. But sometimes things don't go according to plan. You repair a cleft of the lip or palate, there can be some residual issues that you may not have got where you wanted to be, and you may have to revise them. So these are additional surgeries that may be required, but it may not be essential in all people. Sometimes the nose can be an issue. The child grows up and though it has been repaired, is not very happy with the nose, and then you could do a cosmetic correction of the nose. So there are a number of other additional things that may be required in a particular individual, but primarily we do 3 surgeries to a child that has a cleft of the lip and palate.
Yeah, thank you. I have another question from Faisal, and he wants to know that is there a difference between repairing the left side of the cleft versus the right side?
I don't think there is much of a difference. It's just that what tends to happen is that clefts can be one-sided. Sometimes they can be two-sided as well. So we call them, in our parlance, unilateral and bilateral clefts. If the cleft is on both the sides, that one is generally a more difficult cleft to treat than if it is on one side. But if it is only on the left or the right, there is not much of a difference.
Okay, so the same person is asking that there could be a cleft lip with or without palate. So it could be just the lip or just the palate. What is the difference, the feeding possibilities in both the cases?
Right. Yeah. So with the cleft lip, feeding is not an issue at all. You can start breastfeeding. The child adjusts very easily, and we don't have any more issues once the child learns how to feed. But when it is cleft palate, though you could try breastfeeding for various reasons, including the bond that develops between the mother and child, it is not going to be adequate. It cannot be the only means. And in most instances, it doesn't work. So we will have to develop a different technique for feeding. Like I said, you could express breast milk, or you can use a formula feed. You can use milk that you buy from the shop, and then use either a spoon or a small little instrument called the palada, and also various specialized bottles that are available, which is meant to help these children feed. Yeah. So with a cleft palate, you need some training, you need some understanding of the issues involved, and most medical personnel who are involved in treating these children will be able to help you.
Oh, thank you. That's fantastic. Thank you so much, Dr. Krishnamurthy, for that wonderful session. And thank you so much to BabyChakra and your fantastic team, and all you wonderful women who are on BabyChakra. Thank you so much for listening to us. Come help us change the world one smile at a time. Come join Smiletrain. Thank you so much.
Thank you, Mamta.
Thank you.